Right now, what's happening in California and many parts of the world is that we are adopting a suppression strategy. Suppression is a strategy in which we are doing social distancing of the entire population, regardless of whether or not you have symptoms, and we're doing this for a long period of time. If we let the virus run its course, if we continued with life as normal in which people are attending large groups, the virus would greatly exceed our healthcare resources. The Imperial College published a paper discussing a projection on what would happen if we let COVID-19 infect as many people as it would. We would have a case in which 30 times as many people will be infected as we have beds for. And that is another way to say, if we had 30 people who are infected with the coronavirus, we would only be able to hospitalize one of them. By doing a strict suppression strategy like what we're seeing in China right now, we are able to greatly reduce the number of new infections. The issues with this approach, the first is that the virus can come back immediately after we stop suppression. Immediately after we stop social distancing, once people begin to resume life as normal, the virus still exists. It can come back in full force because while everyone was practicing social distancing, not leaving their homes, their adaptive immune system never had a chance to actually encounter the coronavirus. When it is encountering the coronavirus for the first time, you're going through your primary immune response and you will have severe symptoms and you may need to get hospitalized. So the light blue curve that we see on the right here is showing us what will happen. We can potentially have the exact same thing happen to us as if we did nothing once we stop our suppression strategy because of the fact that we have not acquired our adaptive immunity to this disease. Number two here is that there are severe economic costs to adopting such an aggressive suppression strategy. The first, which we are seeing in China right now, is that there's been a 20% drop in retail sales because people are not in markets anymore. And there's also been a 24% drop in investments. And this aggressive stance doesn't necessarily mean that we will be saving more lives in the long run. And so a milder form that we can go with is called a mitigation strategy. Mitigation is much more reactive rather than proactive to infections. What we do here is that we will take old, ill, and compromised refers to having a weakened immune system. And what we do is we just isolate these people. While we will save more lives by adopting this strategy than if we did nothing, we will still significantly exceed our healthcare capacity because we still have very low numbers, very few healthcare resources available to handle a pandemic at this scale. And so to come back to what we were discussing earlier, we are very interested to see what happens in China after they lift their suppression. They've essentially reduced their number of new cases to 0, which is great. But the question that we're all wanting to answer is, once they've lifted their suppression, will there be a spike in new infections? Because when people go back to life as normal, that virus is going to be there just like it was before, and it can begin infecting people just like it has been already. While that is scary, and while we are still waiting to learn how this virus will respond, we do have some good news, and that's in South Korea, which is geographically very close to China. They peaked at 800 new cases a day, and they were able to reduce this number by performing a national screening campaign. South Korea was screening 10,000 people every day, and they've screened 310,000 people in total as of March 16th. And by screening so many people, they were able to effectively identify who had the disease, to quarantine them, and then also aggressively track the cases of infections. That being said, we do need to address problems that exist in our screening methods because we need to take a long-term perspective here and not just a short-term perspective. So while South Korea was able to reduce their number of new cases, the issue is that if you've been infected with the coronavirus, you will potentially be a false negative with our current screening methods because your adaptive immune system will be able to effectively destroy all of the viral genetic material that exists in your cells. But the virus can still exist inside of you. Even though you're not necessarily infected and you're symptomatic anymore, you can still be a carrier, but your body's adaptive immune system is able to effectively prevent the disease from killing you, but you still may be able to spread it and infect other people. What this implies is that we do need to have a new screening method developed because this is the first time we're dealing with this disease. We're going to need to resort to antibody screening, where we draw a blood sample and then we're able to look at what antibodies exist in your blood to determine whether or not your body is fighting or has fought in the past the coronavirus. The issue with this is that blood samples are historically harder to get from people. And so to summarize what we've been talking about here, there are major topics and considerations that we need to take into account when determining a containment strategy. We are essentially balancing between economic and health costs at this point. And the way I view this is that we can essentially close everything and never go outside again. However, the issue with this is that it's going to be very costly and it will cripple the economy, and a lot of people are going to lose their jobs, and people are losing their jobs already. The question to ask from there is, what is the cost of having people with no income? Something that I personally believe in is that life involves risks. It always has and it always will. You take a risk every time you go outside that something terrible can happen to you, but these are things that we must live with. Suppression strategies that are going to be probably the default mode of action from our leaders until we develop a vaccine. Vaccine development's probably going to take at least a couple months, if not a year. A very important note here is that the World Health Organization is begging countries to test people. We cannot fight a fire blindfolded, and that's very true. If we don't know who's infected, if we don't know how many people are infected, we don't know what type of response we should have. So we need to get screening kits out. We need to develop a vaccine. And in addition to that, we need people to listen to the advice of health officials. Please wash your hands, clean frequently touched surfaces, avoid being in large social groups. Also avoid touching your face, avoid touching your eyes, nose, or mouth, because the way you get infected by the coronavirus is by touching an infected surface and then touching one of those areas, because that is how the virus gets inside of you. This is my works cited. It's from The Economist. And how should we respond? Also, the Imperial College Response Team and Johns Hopkins University provided the statistics and figures that you see in these images. So, hope this video is interesting. Let me know if you have any questions, and thank you all for watching, and please wash your hands and be safe.